antibodies.
Joanne Schulz was declared COVID-19 free about 2 weeks ago. Her first test results turned out positive. The other two that were done later turned out to be negative. She spent 6 weeks in isolation at her home in East Newberton, a mandatory health procedure to contain the virus from spreading. But what she went through was not just a health procedure.
I was very much upset with the protocols of my results and how they were handled, and from the first to the second and the recovery results, because I had faced so much discrimination and stigma from the country, from the public eye especially, even from my own province. And I felt, it would be just if there would be a bit of redemption, maybe if the respective authorities and right authorities that announced my results in the first place declare my recovery to the public.
The declaration of her status sent a wave of fear across East Newberton province, prompting a lockdown for more than a month on a scale rarely seen over the years. While remaining in isolation, she says she has been contacting the Office of the Prime Minister and the SOE controller, seeking answers to how her case was handled.
So the purpose of the RDT is actually to pick up on antibodies and to turn out positive. So then that test will show that you already have antibodies in your system. So it also confirms that you did have the coronavirus. Whereas in my case, I did have a rapid diagnostic test done. The RDT was done after my third test result was revealed. And my test result from the rapid diagnostic test came back negative. So it goes to show that, to my understanding, is that I never had the coronavirus in the first place.
The response from the government was daunting. The announcement of her test results was a single call that carried many implications.
And she's now under strict isolation. As I speak today, the local team on the ground will move into her village, and her village will be completely isolated, and we will do backtrace of a series of tests. But this has, for me, given indication to our own ability. In the radar of those persons of interest, we've been able to pick early on that she possibly might be a suspect case and was a person of interest, and she returned positive. So it gives some level of comfort to us that our own system that we've established amidst many of our so-called pronounced deficiencies, our actual networking of person of interest, for one, in this one, brought in a positive case for us, and it could indicate to us that we have some sort of system in place that is able to track people.
Meanwhile, the Office of the Controller and the Prime Minister received a backlash from the public on social media. The incursion of COVID-19 has brought to light yet again PNG's ailing health infrastructures, and the capability to carry out medical procedure on serious health issues such as a pandemic had questioned the preparedness of the country to respond. Even community awareness on COVID-19 was well behind schedule in many communities before the first case was declared in the country. And comprehending and assessing a COVID-19 situation was something that was lacking amongst a majority of the people before the country went into lockdown. While much of the government attention has been on containing the virus from spreading, Joanne says there is a human face of COVID-19 that needs a voice. She recalled one of the moments when she was sent into isolation that prompted not only fear but a social hatred and incitement by the public.
I hope that the government can do better in future, and maybe this can be something they can seriously look into and learn from, and how to deal with another situation 10 years from now, 20 years from now. But no Papua New Guinean should be put through a situation like the one I was put through. We are the people of this country. We are the citizens of this country. We make the authorities. We make the government. These are the luxuries we deserve as people.
Joanne works as a health volunteer based at the Nonga General Hospital, who deals with TB and HIV patients who were neglected by their family members. For Joanne, stigma and discrimination is something that isn't new. But for now, she is trying to rebuild her life and to accept the fact that she had coronavirus and she survived it.
Had people, you could just hear and feel people talking about the situation, but by then I was just going into absorbing everything and accepting the fact that, this is how my life will be from now on, is that, even though I had an identity as a volunteer, I will now be seen as the COVID-19 patient of East New Britain every time I enter the public eye. And that is something that it'll take quite a while to deal with, but I'm willing to move on and not dwell on everything that has happened, and find my strength in the response of the public and the kindness of people that I'm surrounded with. And with that, I will hopefully continue in doing the work that I want to do and trying to get back into some form of normalcy in my life.